Alrighty, hello everybody.
I don't know.
Don't say it.
You could have been anywhere right now,
Nancy, we hit you over the head.
but you chose to be here, and we've only got another 4 weeks to be here.
Take him down, Nancy.
Alright. So, my patient was female. She's 18 years old, and she's an HSC student. Her main stated issues when she came in were sinus headache, jaw pain, lower back pain, eczema on the face around the chin and nose, and suffers anxiety and stress. So sinus headaches, jaw pain, lower back pain, eczema on the face, and a bit of anxiety and stress. So she came in for the first treatment on the 28th of June. Oh, and by the way, there's some photos coming up, and they've been used for full permission of the patient. Okay, so with the sinus headache, she gets them twice a week or more since the age of 10. Around the right side, right eye area, it's described as being like a migraine, debilitating, like a hammer strike to the right eye. There's some nausea associated, and it's worse at night. There's pain on palpation of the sinus areas, and she's had 3 previous operations to remove polyps in the sinuses at ages 11, 14 and 16 years old with no success with pain relief. She gets jaw pain below the ears, but also around the surrounding areas too. It's always uncomfortable for her, sometimes painful to touch and to open her jaw, and it's a chronic condition. She had a sports injury with sprain to the jaw 2 months ago as well, and she gets jaw clenching at night. When she's stressed, she uses a guard. She wakes up and the face is swollen, along the left side more than the right, and it's described as puffy. The onset was described as being at the age of 13 during a growth spurt, where the lower jaw began to protrude further than the upper jaw, and her father suffered a similar kind of situation, and therefore it may be hereditary. The situation is aggravated because she's a keen and practicing trumpet player. So you can imagine the effect. With the lower back, she gets sharp pain, radiates up the sides into the shoulders, and she injured the area 1 month ago and 2 years ago. With the eczema, she's had it for a number of years and uses steroid cream to help. And she also gets overwhelmed, gets stressed under pressure, feels frustrated easily. She's going through an extended exam timetable schedule at school, has special exam considerations to help with the stress. So just briefly, sinus headaches often referred to as sinusitis. The passageways connecting the sinuses to the nasal cavity become blocked with mucus. In most sinusitis cases there's infection, nasal discharge. However, it's not present in this case. However, cysts and polyps have been removed from the sinus cavities. So in the sinuses, the air becomes absorbed, resulting in a partial vacuum, and the sinus headache is localized over that inflamed area. So, the jaw pain could be developmental, inherited issue, and with trauma, and the same for the lower back pain. Some of the questions with Chinese medicine I went through. She's got a hot constitution, she has some night sweating, so yin deficiency. She sleeps well when there's no pain. Her diet, you can read it there, but she does have some food intolerances like nuts, peanuts and cashews, which are heating. She's got a really strong appetite. She's very thirsty, yin deficiency. She gets constipated, but that's more associated with when she eats wheat. And I considered she went to the toilet quite a lot. She gets stressed easily, frustrated. Also she has sort of liver signs. Also has difficulty of remembering and concentration. So there's some kidney issues there. She feels generally good and I would state her energy is strong, but she kind of like pushes through a little bit to get through the day. And she sometimes feels a bit dizzy. She gets some floaters in the eyes, the liver, issues, breathlessness with exertion, Qi deficiencies. She's only 18. She gets some ulcers in the mouth, which are red, and some high-pitched tinnitus as well. So with the pain, with the headache, it's fixed, intense pain, so blood stasis, worse at night, so some yin deficiency, and pressure makes it worse. Jaw pain is interesting. It's around the stomach channel area. Lower back pain could be a kidney issue as well. Okay. And the tongue is red, cracks. So again, heat and deficiency. And the shoulders are very sensitive to touch, and there's a strong aversion to strong pressure. And I noticed there was tightness and more pain on pressure around liver, spleen, and kidney areas. All right. So the sinus headache differential diagnosis is saying through channel considerations. Pain is due to a number of factors. In this case, pain on palpation is a deficiency. But strong pain is always seen as blood stasis. So just trying to tie it in with deficiency and excess. Excess condition is seen as retention of phlegm, cold or heat in the lungs, and stomach fire. So a bit of stomach fire. Deficiency tend to be lung qi or deficient spleen with phlegm. And the signs and symptoms tie in with some general TCM signs and symptoms trending towards liver issues. Okay. So just expanding on